Hello and welcome. I am Dr. Sara Busch, and I was brought on by the Physicians Committee for Responsible Medicine to share with you what I found at Wayne State University. So first I'd like to introduce myself. I graduated from Michigan State University's College of Veterinary Medicine in 1994. I'm a former professor of animal surgery and anesthesia at a college just outside Philadelphia, Pennsylvania. I am the co-author and editor of a textbook, the former chief animal health official for the state of Delaware, and I'm one of a few veterinarians recognized by the U.S. Department of Homeland Security as a foreign animal disease diagnostician. So what I'd like to tell you about are the heart failure experiments done on dogs at Wayne State University. These have been going on since 1991, and they involve putting dogs into heart failure and hypertension, giving them high blood pressure. The experiments are funded by the National Institutes of Health, and Wayne State has received more than $8 million to conduct these experiments on dogs. 1 in 4 dogs dies before any data is collected, and all of the dogs are killed at the end of the experiments. This one protocol, this particular animal use protocol, is titled Blood Pressure Control During Exercise in Heart Failure. And this particular protocol we obtained along with hundreds, thousands of pages of dog records and documents from Wayne State through the Michigan Freedom of Information Act. So in this particular protocol, the dogs undergo multiple major invasive surgeries during which devices are implanted inside their hearts, inside arteries, and their limbs. These devices have wires and cables that then have to be tunneled through the dog's tissues to protrude out their backs between their shoulders. And then heart failure is induced in these dogs via rapid pacing. So they increase the dog's heart rate from a normal range of 70 to 100 beats, 120 beats per minute to anywhere from 225 to 250 beats per minute. And they have this rapid heart rate for weeks on at a time. And then the dogs are forced to run on treadmills, even once heart failure is induced. So the first dog I want to tell you about is Joni. We have her records, and she first arrived at Wayne State in May of 2013. This is an actual record of her physical exam done on June in 2013. And Joni arrived, and she was originally described as curious and friendly, acting like a puppy. She was basically just turned a year old when she arrived at Wayne State. By August 13th, she had already had 2 major surgeries, and after her second surgery in her abdomen, she had developed a fistula. It says there, fistula developing at the cranial end of left abdominal incision. And a fistula is a draining tract. It's a communication between tissues that isn't normally there. And it's often a result of surgery and is often associated with an infection. So this is in August. And then after these surgeries, this is still August, she was forced to run on the treadmill, during which she vomited. And now in October, they finally decide to collect a sample of an exudate or tissue from her left abdominal area for culture and sensitivity. They now are pursuing diagnostics to determine if that fistula is infected. This is the lab report that came back from the lab where they sent the sample. The sample was sent October 4th. The source of the sample was an abscess, a site of infection, and it came back positive for Pseudomonas aeruginosa, which is a bacterial infection. With this infection, the experiments continue on Joni, and she vomited during an experiment. And then in November, she was euthanized. So Joni initially arrived playful and curious. She underwent multiple major surgeries. She developed an infection. She was forced to run on a treadmill, and these experiments were conducted on her while she was ill. And after 5 months of being experimented on, she was killed. The second dog I want to tell you about is Squeegee, and he arrived at Wayne State in May 28th, 2013. This is the packing list of the shipment of dogs that arrived at Wayne State. And he was just a year old when he arrived. His birthday is listed as May 17th, 2012. He came in the same shipment as Joni, by the way. And so initially when he arrived, he was described as very playful and active. And on the other side of the slide, you can see the physical exam form, again, where he was described as active and friendly. But that didn't last long. In the record here, they've written in that he's scared. And now in August, there's a notation that this dog is allergic to Rimadyl, do not use. That's in all capitals, it's in bold, it's asterisk, it's a big deal. And somehow they determined that he's allergic to Rimadyl. Rimadyl is a medication that's used as an anti-inflammatory as part of a pain management protocol, but he can't have this, and they've noted that he's allergic to it, so they put it on the front and the back of every page of his medical record going forward from August 23rd on. And they note here that he's whining, dog is whining, and he seemed painful when his incision is touched. So these are in their own words, that he's in pain and whining, and he can't have this particular medication to help with that. Later, he's described as depressed, not as active. There's still the notation that this dog is allergic to Rimadyl, do not use. Now we have a surgery report from Squeegee dated in October, and in the process of preparing him for surgery, he was administered carprofen. Rimadyl is the brand name for carprofen. So there's no indication in the record at this point that they noticed their mistake, and there's no indication that they took any corrective actions at this point. And in fact, they gave him a second dose the next day, November 1st. They gave him another dose, 100 milligrams of Rimadyl. And they corrected this, but after having given him the medication he's allergic to, despite all the notations of the warning not to do so. And there's a notation that he is developing a purulent discharge. And purulent is the word for pus, drainage of pus, indicating potential infection. He also has an elevated temperature of 103.6 degrees. And the next day, that purulent pocket under the skin is located. It is bleeding, so there's an indication that this infection is spreading, getting bigger. And then, in addition to having this infection and an elevated temperature, there's a notation for the technicians to record appetite. And at the bottom of the column for appetite on Squiddy for this day, he has no appetite. He's not eating. And on this notation from his physical exam form, they set his heart rate at 225 beats per minute in order to induce heart failure. And when they came in to record the records for Squeegee on this day, they found a hole in his arterial line. They put a new extension on it and used duct tape. So a hole in an arterial line is a pretty big deal because it's an artery is a high-pressure vessel, blood vessel. Veins are used all the time to put catheters in. Arterial lines are reserved for more major procedures, and a hole in the arterial line would be potential for significant blood loss. And then he was put on the treadmill, and he vomited. On January 19th, 2014, there's a notation that his abdominal incision was tender to the touch. That's a way of saying he was painful. And on the next day, they found a large amount of frank blood or fresh blood from the exit sites where these cables and wires are leaving, actively bleeding, and it ended up with him being euthanized. So Squeegee arrived very playful and friendly. He was later scared, depressed, and painful. Those are their words and their records about Squeegee. He had 5 surgeries. He developed an infection. He was repeatedly given medications despite his allergy to it. He had an arterial line repaired with duct tape. He was forced to run on the treadmill. He had a fever. He was vomiting. He lost his appetite, refused to eat. And 8 months after arriving at Wayne State, he was killed. So these are just 2 dogs' records that I've shared with you out of hundreds of dogs that have been used in experiments over the last 24 years. So if you feel called to get involved, please contact us at the website www.rogueexperiments.org.